So I'll have the screen up just while we kick us off with some introductions. So my name is Daksha Parmani. I'm an associate at the Clinton Health Access Initiative, working on the global markets team that puts together this report. I'll be a facilitator for today's webinar along with Vidhi, and I'll invite Vidhi to introduce herself as well.
Thanks, Daksha. Hi, everyone. My name is Vidhi Lohia. I am a manager also on the global markets team at CHAI. It's great to see so many of you join us today for the webinar. To get us started, I would like to invite Mansi Chitalia to introduce herself and share some opening remarks. Mansi is also one of the panelists on the panel discussion today, so you'll hear from her later as well. Over to you, Mansi.
Thanks, Vidhi. Hello, everyone. I'm Mansi Chitalia. I am a director on the global markets team at CHAI. I lead the market shaping work on women and newborn health commodities. First of all, thank you for joining us today as we launch the 10th edition of the Family Planning Market Report. We're quite excited. First, I would like to start out with just acknowledging the incredible partnership between CHAI, RHSC, and FP 2030 that has made this report possible. Since 2015, we've worked together with a shared goal. It is to improve market visibility and to support healthy markets for family planning commodities. This report has played a critical role in shaping our collective efforts over the last decade. I want to especially recognize the contributions of all our collaborators, some of whom have joined us today, procurers, donors, community partners, and particularly suppliers who make this report quite unique. The data that we receive from over 18 supply partners, usually they compete in the market, but this not only has given us a comprehensive view of the market, but also showcases the power of collaboration that coming together really can help. This kind of partnership is rare and truly remarkable, so I do want to sort of take a moment to just acknowledge that. Over the years, we have seen significant progress towards healthy markets, broader choices of methods now accessible, better supply security, and also greater affordability. You can see this reflected in kind of the expanded scope of the report, but also this really translates into the 92 plus additional women who have now been using modern contraceptive methods since 2012. However, I also want to take a moment to acknowledge that as this year's report highlights, we have emerging challenges, such as sustainable financing for contraceptive procurement. And these issues remind us of the work that still lies ahead. I am quite excited to share a new feature that we have with this year's report, which is a dedicated website with an interactive dashboard. This tool allows for much easier data exploration and analysis, and hopefully makes the insights more accessible and actionable. So just as we deep dive into today's discussion, I hope that this report sort of continues to play an important role as we work towards sort of a world where every woman has access to the contraceptive method she needs and desires. Thank you, and back to you, Vidhi.
Thank you, Mansi. Before we jump into the agenda for today's call, I have a quick poll for all of you, which will show up on your screen now. The question is this your first time engaging with the FP market report? I'll give you a few seconds to respond. Wow, I'm seeing a lot of first-time explorers, although there are seasoned readers as well. And so for those of you who are first-time explorers, we definitely recommend you to go on our website, the link to which Daksha just shared on the Q&A or chat function. I'm unsure, but yes, please go and look at that link and download our report over there and read it. I'm still seeing some answers come in, but in the interest of time, I'll just end the poll. Great. So in terms of the agenda for today's webinar, The first agenda item is report overview and key findings. This segment is for about 20 minutes, but we'll share with you some of our key findings from the report. The second segment is a panel discussion. We have 4 panelists joining us for this discussion. This will be around a 20-minute discussion. And then towards the end, we've saved 10 minutes for Q&A. A few notes on the Q&A. The panelists have also agreed to stay on for some extra time at the end of the 10 minutes in case there are unanswered questions. We also request you to start putting your questions in the Q&A feature just as you progress with the webinar. And then if there are still unanswered questions by the end of the webinar, we will reach out to you over email to answer that question. Next slide, please. I'll begin with the report overview. So in terms of the report structure, there are 4 key sections in the report. The first one is the supplier shipment analysis, which covers public sector contraceptive procurement trends over the last 5 years. That is 2019 to 2023. The second section of the report is the UNFPA and USAID procurement value analysis. This section provides an overview of the total spend by these procured contraceptives in the same time period. The third section is on domestic government spend analysis. This section tries to shed light on countries that are using domestic funds to procure contraceptives. And the final section of the report provides qualitative insights from discussions with various stakeholders. Next slide, please. In terms of the scope of the report, we have received information from 18 participating suppliers that inform the trends for the market analysis. The focus is on the public sector market. We have focused on modern methods of contraception in the report, which include implants, IUDs, pills, injectables, as well as condoms. And finally, the scope is for low and lower middle income countries as defined by the FY 2024 World Bank Income Classification. That adds up to 85 total in-scope countries. With this, I'll pass it over to Daksha to run us through some of the key market trends.
Thanks, Vidhi. And so excited to see everybody here. To keep the engagement going, we have another quick poll before we jump into the data for today's from this year's report. So I'm going to bring this up on your screen. The question is, how did the market evolve from 2022 to 2023? This is to test your market insights for the public sector contraceptive market. Okay, see a lot of people indicating that they think the market has grown this year. And while responses are still coming in, I'm going to stop the poll here because I think the answer has been given away. You're right, the contraceptive market did grow. And we measure the market through 3 metrics. So the 3 metrics that we look at are market volumes, CYPs shipped, and market value. Across these 3 methods, we see that there has been a 15% increase in the market volumes, a 17% increase in the CYPs shipped, which refers to the couple years of protection shipped, and a 9% increase in the market value, which is measured in US dollars. I'll share a little bit more about what these terms mean and how we calculate them. The market volumes come from the supplier shipment data directly that Vidhi just spoke about. They have been aggregated to maintain confidentiality, and they're the basis for the calculations for the couple years of protection shipped and the market value. The CYPs shipped, or couple years of protection, is calculated using a CYP factor. The CYP factor is an estimate of the number of units that are needed to provide a couple with 1 year of protection. So for example, there are 4 units required of the 3-month injectable to provide 1 year of contraceptive protection, and thus the CYP factor is 0.25. In order to calculate the CYPs shipped, we divide the volumes by the CYP factors to calculate this metric. This enables a more standardized comparison across the methods, especially for longer-acting methods such as IUDs and implants that provide multiple years of protection per unit that is shipped. Next, I'll speak a little bit more about the market value. The market value is calculated using the publicly available unit prices from the UNFPA contraceptive price indicator, and this is used to size the market. It's interesting here to note that the market value that we see has not increased as much as the CYPs that have increased by a more notable 17% compared to the 9% increase in market value. This reflects the procurement of more cost-effective methods, such as LARCs, which have a relatively lower cost per year of protection that they offer. So in other words, we see more contraceptives are being shipped, they're providing more years of protection, but the overall spend hasn't increased as sharply because of these cost efficiencies. Before we dive into the more method-specific market trends, I'm going to launch another poll to test our understanding of the methods shared, the metrics shared so far. So I'm going to bring up another poll. Yeah. So the next poll should be up on your screens now. And the question here is, which of the following 4 methods saw an increase in the CYPs shipped in 2023? Okay, lots of answers coming in. We see injectables leading currently, with implants following closely behind. Okay, I'm going to give this a couple of more seconds while we wait for folks to respond. Okay, I'm going to end the poll, and here we see that the results say that injectables was the method that saw an increase in CYPs shipped, followed by implants, oral contraceptives, and lastly, copper IUDs. I'm going to move to the next slide so we can dig a bit deeper into these trends. So on this slide here, we have a view of the couple years of protection shipped, and most of you selected, injectables, but here we can see that actually all methods saw an increase in the CYPs shipped. That was a bit of a trick question, but I will share a little bit more about the trends. A quick note on the orientation of this slide. On the left-hand side, we see that the graph shows CYPs shipped from 2019 to 2023. We look at the last 5 years for our trend analysis, and this is measured in millions of couple years of protection shipped. On the right-hand side, we have a table that shows the year-over-year increase across all methods. And here we can see that there has been a 17% increase in the total CYPs shipped across all methods, whereas the various other methods have seen different levels of increases. One note to call out here is we already discussed this, but the increase in looking at CYPs enables a more interesting view for the long-acting methods, as we can see the number of years of protection that is offered by these methods. So I'm going to move to the next slide to deep dive a bit into these longer acting methods. But before we get to that, I do want to indicate that the method that was driving the largest increase in CYPs was copper IUDs, which we can see in this bright blue graph, bright blue segment of the bar chart here, which increased from 33 million to 45 million units. So on the next slide, I just want to talk through the 3 different methods that we cover, long-acting methods that we cover, starting with hormonal IUDs. We see that there was a continued growth in the CYPs shipped from hormonal IUDs in 2023, as this method is being introduced and scaled up across countries. The next method I want to talk about is copper IUDs. When we look at this bright blue segment of copper IUDs, we can see that they have a cyclical procurement pattern. This procurement pattern owes to the method's long shelf life of approximately 10 years and long duration of protection that it offers of about 3 to 7 years. Because of these unique characteristics of this method, we can see countries procure large quantities in some years and then lower quantities in subsequent years, which leads to this kind of cyclical procurement pattern. And finally, the last long-acting method that we want to talk about is implants. We can see there was a slight growth in the CYPs shipped from implants from 2022 to 2023 of about 40 million units. But we can see that this has plateaued at this 40 million units over the last 4 years. Another view that I want to show just of the CYPs before we move to the other metrics that I had mentioned is the share of contraceptive procurement that comes from long-acting methods. These 3 methods that we just discussed together comprise the majority of the CYPs shipped, up to 64% in 2023. Their market share has grown by 1% from 2022 to 2023, and they've maintained the larger share throughout this 5-year period that we've analyzed. Next, I'll look at the trend in market value. On this graph here, we're tracking market value in terms of millions of US dollars. The key trend that we want to highlight here is that the market value increased by 9%. And as discussed earlier, this is lesser than the 17% of CYPs shipped, due to the cost-effective nature of long-acting reversible contraceptives. And here we can see that the method that contributed the most to the increase in market value is male condoms, that increased from 36 million units in 2022 to 45 million units in 2023. Finally, the final view of the market that we have here is of market volumes. I'm going to quickly orient you to the slide since we have a lot up here. You'll see that we've included male condoms in a table at the bottom right side of this graph. We've done this just given the scale of these orders. The 1.7 billion units of male condoms in 2023 are much larger than the pure volumes of all other methods that have been procured. So we've pulled this out of the graph to best show the data. Looking at the data and the graph, we can see that procurement volumes have increased from 2022 to 2023 by 15%. There are some notable method trends that we'd like to call out, and I'm going to start with emergency contraceptives. The emergency contraceptives in the light green here, we can see that their volumes have increased by 11 million from 2022 to 2023, going from 8 to 17 million units. And there's also been a notable growth over this 5-year period from 9 million to 17 million. Next, we'd like to highlight the trends for combined and progestin-only orals. This method trend has been one of the big drivers of the increase in volumes in 2023. And this trend is largely influenced by one country, Bangladesh, where this method is a notable portion of their method mix. So I'm going to go back to 2021, where we see this big decline in oral contraceptives. And this was largely driven by a decline in procurement volumes from Bangladesh, whereas the remaining countries, excluding Bangladesh, actually saw an increase. But when we look at the data from 2022 to 2023, we see that this increase was largely driven by an increase in procurement volumes in Bangladesh, whereas for the other countries, the procurement volumes remain stable. It's interesting here to see that over these past 5 years, there has been this overall decline, and we see that trend remains consistent across all countries, both including and excluding Bangladesh. It will be important to continue monitoring these trends going forward, especially to make sure we understand what the drivers of this the trends of this method are. And finally, just a quick note on male condoms. We did see an increase in male condom procurement over this 5-year period and a massive increase from 2022 to 2023, reaching a 5-year high of 1.7 billion units. This brings us to the end of the supply shipment data that we wanted to share. And before we transition to the next piece of analysis related to UNFPA and USAID's procurement value, the two largest global procurers of contraceptives in the space, we have another quick poll to test how much you've been listening. So I'm going to bring up the next poll in a second. It should be on your screen now. So the question here is, we've seen an increase in the contraceptive market. So let's predict how we think UNFPA and USAID's procurement value evolved from 2022 to 2023. I'm going to have this up for a couple of seconds to see what the votes coming in are. Okay, I see a lot of votes have been cast for an increase in the procurement value, with some people indicating no change in procurement value and some seeing a decrease. I'm going to stop the poll now to get into the data without any further ado. So your predictions are correct. We have seen an increase in the procurement value. I'm going to start off by sharing the trends for UNFPA. So diving into the data for UNFPA's procurement value, we collect this data with the UNFPA through the UNFPA Supply Chain Management Unit. This data can be broken down into two segments: the UNFPA program procurement, which is in the darker blue segment, and third-party procurement. The third-party procurement here refers to procurement that is done through UNFPA on behalf of governments and other customers, which could include other UN entities, nonprofits, etc. The data that we have up on the slide shows that there has been an 11% increase in spend from 2022 to 2023. However, most of this is driven by third-party procurement. It's interesting, it's exciting to see here that the UNFPA contraceptive procurement has reached 178 million US dollars, the highest value that's been seen in this 5-year period, surpassing the peak levels that were seen in 2019 and 2020. This increase of 11% over the last year, and 2% over the 5-year period is quite notable and very exciting to see. The increase in third-party procurement can largely be attributed to an increase in domestic financing, and this has been facilitated by a couple of different avenues. The first is the availability of the UNFPA Supplies Match Fund, the signing of UNFPA country compact agreements, and commitments that countries have made towards strengthening domestic financing. Next, I'm going to take us to look at data from USAID. So the data for USAID comes from the Overview of Condoms and Contraceptive Shipments report that USAID publishes each year. This data shows that the USAID procurement value also increased in 2023, reaching a 5-year high of $59 million. This increase was an 11% increase in the last year and an 11% increase over this 5-year period. The next section that we have data available for is some insights on domestic government spend analysis. So this looks at spend that countries have mobilized for contraceptive procurement specifically. And before we dive into this data, I'm going to have one final poll for this section. So bringing this up on your screen now. The question that we have here is, which of the following 4 countries spent more than $1 million on contraceptives through domestic financing in 2022 or 2023? So in the last 2 years, which of these countries had a notable level of government expenditure for contraceptive procurement? Okay, lots of votes coming in. Ethiopia is leading, followed very closely by, it's a tie between the remaining 3 countries. Okay, Malawi makes its way forward a bit. And I'm going to end the poll here to reveal the results. And this was another trick question. All of these 4 countries have spent more than $1 million on contraceptive commodity procurement through domestic financing. And I'll share a little bit more about where we get this data from before sharing the other countries that have also had this level of expenditure. Okay, so for this analysis, we've put together insights from 3 different data sources that provide visibility into domestic government expenditure on commodity procurement specifically. These 3 sources are the USAID Contraceptive Security Indicator Survey, the UNFPA National Budget Allocation and Spend Data, and Track 20 Family Planning Spend Assessment data. These 3 sources look at data from 2022 to 2023, and they're collected via either a survey of national governments or using, and the Track 20 data uses an estimation methodology using international costing standards, and these results are validated by governments. 2 of these data sources are publicly available and can be examined independently. This is the USAID data and the Track 20 data, which can be accessed online, and the UNFPA data was shared with us directly for the purposes of this report. These data sets, the USAID data is collected every 2 years, while the other 2 data sets are collected each year. It's interesting for us to look at these 3 data sets together, because when we look at these 3 data sets, they allow us to provide a more composite and a whole understanding of what domestic expenditure looks like across countries. As these data sets have varying time periods that they cover, they have slightly differing methodologies, and they also provide visibility into a different set of countries. So together, this provides us with a more composite view of what domestic financing looks like in low and low middle income countries. Through these 3 data sources, we've put together this view of countries that have notable expenditure on contraceptive procurement. We define these as countries that spend more than $1 million on contraceptive procurement. And here we can see that we bucketed these countries into 4 buckets. This is $1 to $2 million, spend of $2 to $5 million, spend of $5 to $10 million, and more than $10 million. Everybody's prediction here was correct that Ethiopia has a notable level of expenditure. And in fact, they spend more than $10 million in contraceptive procurement in the last year that we've analyzed data for. And accompanying Ethiopia is also Bangladesh and Pakistan in this bucket. There's a longer list of 13 countries that fall within the 1 to 2 million bucket. And here you can see the countries that we had up, which was DRC, Madagascar, and Malawi, all of which have spent, between up to $5 million here. Together, these comprise of 24 countries that have had a notable level of government expenditure. And when we compare this to last year's analysis, we had identified 22 countries in last year's family planning market report. So this increase in over that 22 countries actually indicates countries' growing commitment towards sustainable financing. Next, I'd like to also share some data that we have. In addition to the data that we just shared, UNFPA has also provided us with some insights from their match fund application process. The UNFPA Match Fund is one of UNFPA's domestic financing tools that they have launched. It's meant to incentivize domestic resource mobilization at the country level, and UNFPA does this by matching government contributions towards quality assured reproductive health supplies. One of the key highlights from this data that they've shared with us is that there's been a significant increase in government spending on contraceptives, and this has increased from 10 million in 2020 to 45 million in 2023, a fourfold increase in just 3 years across the 54 UNFPA supplies partnership countries. UNFPA has also seen improvements in budget execution rates. A growing number of countries have increased their allocations for contraceptives and spent at least 80% of their allocated budget. The countries meeting that criteria was just 4 in 2021, and this grew to 21 countries in 2023. Looking ahead, there is continued momentum that we see with 40 countries that have re-signed the UNFPA Compact agreements. 30 of these countries have made commitments that exceed the minimum requirements for domestic financing that UNFPA has outlined, and 21 countries have actually made multi-year commitments towards increasing domestic financing. These shifts highlight government's commitment towards ensuring that there is sustained access to contraceptives at the country level, and the family planning community must remain committed to tracking these trends at the country level and appropriately supporting and incentivizing domestic financing. I'd like to end this section by just talking a little bit about the appreciation that we have for the data that the community has collected and the incredible visibility that we have into government expenditure through these sources. However, as the importance of domestic resource mobilization grows, better quality data will be needed to develop strategies to sustain this transition towards country-led financing. In order to achieve that, a couple of key priorities from a data standpoint that we've identified include: 1, building government capacity to track and report expenditure data, as current methodologies rely on estimates or self-validated data by governments. Next, we'd have to look at refining data collection methodologies. And we've discussed this in some detail before, that a lot of the data is self-reported or based on estimates. And the third one is to ensure that the data is transparently available for the community to analyze and explore, which will enable this further use of the data. And finally, a deeper understanding of how funding is allocated across contraceptive methods and the trends at the country level will be important for us. This visibility will support the community and governments in developing robust multi-year financing strategies to ensure that there is a sustainable transition towards contraceptive procurement that doesn't compromise method choice or quality. This brings us to the end of the quantitative section of today's report's findings. And you can read the report and dig more into the data at the FP Market Report website that we've recently launched. The interactive dashboard is a great source to dig further into this data that we've made available. I'll now hand over to Vidhi to moderate the panel discussion.
Thank you, Daksha. Next slide, please. We're very excited today to have 4 esteemed panelists join us for the panel discussion. I'll begin with introducing our panelists. First, we have Ntinda Luembe, who is the Director of Implementing Mechanisms and Initiatives at the Reproductive Health Supplies Coalition. We have Dr. Rahil Bilete, who is the Vice President and Country Director for Ethiopia from CHAI. We have Mansi Chitalia, who is the Director of the Global Markets Team at CHAI. And finally, we have Jason Bremner, who is the Senior Director, Data and Measurement at FP 2030. Thank you all for joining us today. Daksha, could you take the slide down so I can kick off the discussion? Thank you. So based on the findings we have shared earlier in the webinar today, we know that over the past years, we've witnessed significant growth in access to contraceptives. However, there are still several challenges that persist, and more work needs to be done. Keeping that context in mind, I will first turn to you, Nintinda. I would like to get a sense from you what the challenges are in the public sector that are impacting contraceptive procurement and uptake. And it would be great if you can share thoughts regarding funding landscape and systemic barriers to access.
Okay, thank you, Vidhi. Thank you for that question. Joining us today. I would like to break down my response into 3 parts. So the first thing is public and private funds are insufficient to meet demand today. Simply put, we don't have enough money to maintain adequate stock levels of contraceptives in many countries. And we know that resources and consumers. And while domestic expenditure is rising, and we just got that from Daksha, the reality is that international donors still show the bulk of funding for contraceptives. Therefore, shifts in donor priorities, given the multitude of global crises we're experiencing today, will exacerbate funding gaps in the public sector. To understand, measure, and support actors in addressing the visibility and analytics network, often referred to as the VAN, has been leveraging country-level data since 2021 to identify these funding deficits, prioritize financing efforts, and mobilize additional funds. For example, in 2023, the analysis helped inform the Gates Foundation's decision to commit 100 million to UNFPA. In 2024, the analysis has revealed 157 million shortfall across 28 countries, with 5 countries accounting for about 70 billion, around 50%. And then secondly, while it's encouraging to see a positive funding outlook from UNFPA and USAID, the rate at which these funds are increasing hasn't quite kept up with middle income countries. So this increased demand, coupled with a shift towards more costly methods like implants and injectables, does apply more pressure in budgets. Thirdly, beyond commodity financing, we must also recognize that cross-cutting systematic issues such as programmatic financing constraints, supply chain management challenges, ongoing training, awareness building efforts, data quality, and availability gaps will continue to impact procurement and uptake in most countries. And just to close, I would say, looking forward, I think our contraceptives not just adequately, but intelligently. This calls for optimizing resources and ensuring that financing approaches are through continued partnerships, active collaboration, and adaptive strategies, we can meet the needs of women and adolescents and girls, ensuring equitable access to contraceptives. Thank you very much, Vidhi. I'll pass the floor back to you.
Thank you, Nintinda.
Vidhi.
Can you hear me, Nintinda? Okay, I think there was a little bit of internet connectivity issue, but I think we got most of what you were saying. So thank you for sharing those insights on the funding gap. I think that's really interesting, and all of the other things regarding systemic barriers to access. I would like to turn to actually Dr. Rahil now to just get your insights on how Ethiopia is dealing with some of the funding issues. And at the country level, how are you resolving for the funding gap that you might see? Over to you, Dr. Rahil.
Okay, thank you so much. I think you have seen, like, Ethiopia is actually taking, the domestic resource mobilization quite seriously, because one is our demand, because of our population side, we cannot just rely on international resources, because we know for sure, globally, there is a decline in international support in this regard. So we have taken proactive measures. And as in 2021, Ethiopia made a commitment to FP 2030, and that really brought up a lot of things into perspective. And then, the UNFPA Compact followed in that space. That's also additional way to make sure that the government is committed. And Ethiopia has also had what we called a pool fund, the Sustainable Development Fund, in place for quite a long time now, which actually helps, to procure majority of our, family planning commodities and maternal health commodities in general. These are the resources that we are using. And at the same time, toward this, late 2023 and early 2024, there is also additional compact that we have signed, the government has signed with other additional partners, which actually being pulled now together as one compact, but other donors like BMJF, the Packard Foundation, anonymous donor, are actually putting together quite significant amount. And the government had also committed in matching fund, and significant local resource mobilization has been generated in that space. And that was, with the earlier presentation, we have seen in 2021, 2022, 2023, over 10 million contraceptives when we procured using the domestic resource. But when we say domestic resource, is a combination of all the resources that I have indicated early on. However, this doesn't mean that we have actually addressed the entire need. We still have gap that we need to fill in, but I'm really confident to see that the government commitment, the leadership, and the support that we are getting also from the international community is really making the difference. And I'm sure that I don't want to prompt the number, but for 2024, you will see even a significant high in the procurements, for the upcoming year. But in spite of all that, performance, especially during the June this year, we have, economic shift. Rather than having earmarked foreign currency trading, now we are opening it up, and that brought in a huge inflation. And we are still trying to monitor what does that mean in regards to containing, the overall market in the country, and the impact which is going to have, on the government contribution going forward. But so far, we are really seeing a positive, trend. So in general, what I can see is, government ownership, government leadership, and even as you are putting the different compacts, having that buy-in from the government, and government, taking the lead and making the decision. Sometimes you may have those pool fund, but who takes that decision is also very critical. So those are the lessons I think we can bring in regarding to domestic resource mobilization from Ethiopia's side. Thank you. Back to you.
Thank you, Dr. Ayel. It's always great to get country-level insights, specifically on how Ethiopia is working towards domestic resource mobilization and the lessons that you've learned. Moving on to you, Mansi, in addition to strengthening public sector financing, could you share your thoughts on the role of the commercial sector and the efforts that we need to make towards total market approaches?
Thanks, Vidhi. I do think it is important to acknowledge that the commercial sector is an essential and growing channel where many people already access their preferred contraception method. I think recent data from RHSC LEAP report reveals that about 30 to 52% users in low and lower middle income countries, respectively, access contraceptives through the commercial sector. These estimates vary by method and country, but can be as high as 75% for some of the methods, such as male condoms, So this doesn't represent like a marginal contribution. It is a substantial and strategic market segment with its unique strengths that should be leveraged as we develop comprehensive family planning product access strategies. I think the report highlights some challenges experienced with growth in the private sector, such as limited demand for certain methods in the middle income segments, competition from lower priced products, product leakages from the public sector, and weak distribution channels. However, suppliers have also shared that they anticipate growing commercial sector demand, particularly with improvements in local pharmacy coverage and local and supply chain logistics improving. And that combined with increased awareness with the introduction of new methods in the public sector, I think there is an expectation that private sector demand is poised to grow. We are also seeing the communities increasingly interested in adopting total market approach that recognizes the complementary roles of the various sectors. So really thinking about what are the investments needed and is there a need to try out new models of distribution? I think the aim is to significantly increase access to contraceptives across channels, both in order to broaden access to new and hard to reach users, but also to ensure market sustainability. I think I would probably close out with sort of saying that there is a need for greater visibility on the total market for contraceptives across all sectors in order to provide critical input for government, suppliers, procurers, and donors to build a more informed and effective total market strategy. We have been successful so far by adopting a collaborative approach, and I think in this space, we would kind of need to work on it together to support meeting the visibility needs of the reproductive health community as we consider how to best leverage this opportunity around total market approaches that I think we have several partners thinking about. So I think, Vidhi, that's back to you.
Oh, thanks, Mansi, for shedding some light on the role of the private sector. It is very complementary to the public sector, and a lot of women do access contraceptives there. So it is, just want to acknowledge that it is an important sector. Finally, I will turn to you, Jason, to really bring it all together and share how FP 2030 is tracking some of these multifaceted efforts to expand contraceptive access.
Thanks, Vidhi. So it's really a pleasure to be here for the 10th launch of the 10th report. And I'd like to say that it dovetails nicely with several reports that will be coming out this week. Tomorrow, we will be releasing our annual FP 2030 data and measurement report featuring contraceptive use and adolescent youth SRHR indicators across the 85 countries. In addition, colleagues from KFF will be releasing their report on donor financing for family planning. That's bilateral donor countries and the trends. And I think really these complementary reports together can tell a story. Each one on their own only gives us a narrow view into an aspect of family planning, contraceptive use, markets, financing, commodities, and ultimately availability down to the level of the consumer. Our report this year will feature actually an update on that 92 million number that was shared at the outset. In this year, we, across the 85 countries, estimate that there are 380 million women using a modern method of contraception, and that's 98 million more than when we started the FP 2020 partnership in 2012. That is the context of continued growth in contraceptive use, in demand, and in the size of the population of women of reproductive age. We shouldn't forget that there are approximately 1.1 billion women across those 85 countries, and that number alone has grown from in the 800 millions in 2012. So we see greater percentage of women using a modern method. We see a greater number of women in the reproductive age. Put this together with a picture of relatively flat financing from donors, increasing financing from domestic governments, but modest in comparison to that growth in the number of women of reproductive age, and shifts in methods that have been discussed here. Our report shows the real growth in implants. It shows continued evolution of use of emergency contraception. It also is starting to show a shift in injectable use to DMPA subcutaneous as opposed to the intramuscular, although at this point still largely provider injection. We put this package together, and I think we see a challenging environment as well as an opportunity. Growing use, particularly in those lowest income countries where they've evolved and moved out of single-digit prevalence, and a growing number of methods that women want available to them. And it suggests the challenge of financing that, of getting systems to deliver contraceptives to the last mile, and of keeping up with the changing desires of consumers and where they want to get contraceptives from the public sector, from the private sector. I think this needs to be a country-led conversation, and I appreciate Dr. Beleta's in-depth conversation of how that's happening in Ethiopia. And I just want to clarify that our report, while it looks at 85 countries, it really is a bottom-up report. It's coming from the countries to us, those commitment-making countries reporting data. And that's where the conversation needs to happen while we keep an eye on this global view. So I think together, I just want to congratulate all of the partners who work on this data. It's a lot of work. None of us could do it alone. And there's still a lot of work to do. So thank you so much, Vivian. Back to you.
Thank you, Jason. I'll thank all our panelists once again for all the important insights that they were able to share with us on the webinar today. I will now pass it on to Martin Smith to share some remarks before we actually move into the Q&A section. Over to you, Martin.
Thanks so much, Vidhi, and good morning, good afternoon, good evening to everyone on this webinar, which both highlights the latest market report, but also celebrates 10 great years of partnership between RHSC, FP 2030, and CHAI within this venture. And of course, it is a collective effort. There's such a large array of partners, of RHSC members, including our very important manufacturers constituency, that are working hard on this every year over the last decade to really increase that transparency in the market and really aim to ensure that that market intelligence then enables fully informed decision-making to occur. And I was privileged enough to be in Copenhagen last week, where I met 30 or 40 of the key manufacturers within our ecosystem, all of whom eagerly await the publication of this report each and every year. So in RHSC's new strategy, our 10-year strategy, which has just been launched, data remains absolutely central. And the consultative process we had with some 440 members showed that RHSC's work with other partners and our work as a data steward of a large range of global goods, from LEAP, which has been mentioned already, to the VAN and RHVIS, to the Contraceptive Social Marketing Report, and indeed collaboration on this market report, continue to be absolutely central to our strategy and to what our members are asking of us. And furthermore, and this somewhat speaks to a point Jason made earlier on, a demand from our community for these data sets to increasingly speak to each other and be interrelated and be able to be synthesized is a message we have taken on board very firmly, and we'll have a lot more to come in the next year from RHSC and our other partners in data on this venture. Putting data at the fingertips of decision makers, as I say, critically important. And so in this vein, and coming back to this market report, as Mansi said very well in her earlier remarks, we're very proud to have launched the market report today, and our dedicated platform, which really does highlight not only this year's data, but looks back across the decade, gives you an interactive platform, a dashboard, if you like, where you can search to your heart's content. For those data hounds among us, there is a downloadable data table which goes, I think, beyond 7,000 rows. So good luck and enjoy getting into all that, as I certainly have and others have over the last few days. The dashboard's there, as well as the archive of previous reports and webinars, so please do delve into that as you can. So, of course, our journey continues, our work continues. We are 10 years and we are moving forwards, of course. We are moving forwards with some very encouraging numbers, as we've seen from this year's report, but also some headwinds that we see, whether it's the tight financial situation that many of our speakers have highlighted, whether it is some of those political headwinds that are always with us in our SRHR sector, in our family planning work, but we move forwards together. And so this really is a call to action, a continued call to action to continue this global and country level partnership to increase the transparency and access to data, all really in the service of that great informed decision making by those decision makers at the most local level possible. So with those remarks, I'd really like to turn it now back over to Daksha, I think, is that right? Because we really want to get into the Q&A, and we've got lots of questions, I think, that have already come up. So thank you so much, and look forward to the questions.
Thank you, everyone. I'm going to just pull up some of the things that Martin had just talked through while we can keep the questions coming. And Vidhi, I'll turn over to you to kind of field those questions and direct them to our panelists. But I just want to quickly pull up my screen to also show everybody the new website. And this is the dashboard, the impressive dashboard that Martin was just talking about, which has access to the data. And all of these filters are interactive, and we encourage you to go download this data and explore it. Okay, over to you, Vidhi. Thank you.
Thank you, Daksha. And sorry, I lost connection out there, but I am back now, and we can begin with the Q&A section. Okay, I'm just looking at the questions in the chat. The first question that we have here is, will the report's scope expand in the future to include more markets? So yes, CHAI and RHSC will explore the possibility of expanding the scope of the report in the coming years, but I'll also just pass it on to Jason to share some more thoughts here.
Thank you, Vidhi. So this report's a decision to expand from, I think, the 69 countries that FP 2020 was originally working in to the low and lower middle income countries is a difficult one. I think, for us, when we transitioned from FP 2020, which had a 69 country focus, to FP 2030, where any country in the world can make a commitment, it challenges us to provide data potentially across the whole world, except that we don't have data available across the entire world. And so we are limited by what is available. And we chose to keep the scope still a bit narrow, knowing that what we really want to affect is country decision-making. And where are we working? Where can we work? I am actually in Colombia today. And later on today, I'll be launching a new effort from our Latin America, Caribbean region to have a data observatory for this region, because they really aren't present in the FP 2030 set of countries. So we are responding to demand from countries. Any country that makes a commitment, we include into our set of countries that we're monitoring for progress. But just to expand to upper middle income countries is an additional 50 to 60 countries. And without a sense of, the audience for that, those who are using that data, I think it's a real question of, are we diluting our effort? Do we really know that the data is going to be used by our partners? And I think that's what we need to focus on, and why we are cautious about I'm just trying to do this for the entire world, or even for all low and middle income countries. Thanks. Back to you.
Thanks, Jason, for sharing those insights. We do have a question specific to Ethiopia, which I'll turn to you, Dr. Rahil. The question is, how does Ethiopia make decisions on budgeting for contraceptive procurement versus programmatic activities?
Thank you. Each year, we do quantification exercise for our family planning need, which is a bottom-up approach. I think that is one which is a factor in allocating resource. But definitely, if there is no commodity, there is no program. So usually the trade-off comes in that regard. That's why we are saying that there is a gap that requires, additional effort to fill in. But definitely, when it comes to prioritization, commodities get a priority, because without that, we won't be able to move forward. And especially last mile delivery is one of the critical challenge, because the country is vast and still 80% of the population resides, at the rural part of the community. So reaching that part of the people really requires heavy operational cost, which sometimes cripple the program. But that's the strategy that we use. It's a bottom-up approach in general. But trade-off usually happens because of the shortfall of the resource. Thank you. Back to you.
Thank you, Dr. Rahil. I know we're at the 8:30 mark. We're going to stay on for a few more minutes to answer the remaining questions on the chat. So yes, if anyone wants to hang out and hear the responses from our panelists, please do so. The next question is related to the private sector, for which I'll turn to you, Mansi, to share some thoughts. So the question is about whether there is a consideration to include private sector procurement data in the report in the future.
Yeah, so I think we've had some initial engagement with our supplier partners in terms of looking at the data more broadly. For now, the focus has been, as Daksha highlighted, primarily towards the public sector. And I think there is a historical context to it, given that a large share of the procurement funding, commodity procurement, was happening through public sector funds. But I think there is an increasing recognition that we need to look at other sources of funding and see how other sectors, domestic expenditure is growing, but we also see an increasing role of the private sector. And as I flagged earlier, there is a need just to establish greater visibility as partners, donors, suppliers think about what are the innovative models to leverage the strengths of the commercial sector. So I think the short answer is yes, but I also do want to flag that one thing we recognize that there is a private sector and there are suppliers in the private sector that are even beyond what we currently partner with and engage with. And so the challenge in terms of providing that visibility and how complete that picture would be is a fairly daunting task. That doesn't mean that we can't start out, but it is definitely a far sort of broader exercise and requires sort of more engagement with a broader set of partners, suppliers, local suppliers in many cases who really are improving access in the private sector. So we've been doing some thinking around it, and hopefully in the next year's version, we have something additional to report on the private sector as well.
That's definitely the goal. Thank you for sharing that, Mansi. There is another question on the chat regarding a 131% EC share. I will turn to you, Jason, to share any thoughts on the share of ECs.
Thanks. I think this actually fits quite nicely with Mansi's last answer, and just talking about public sector, private sector. So what we're seeing here is simply the public sector procurement of emergency contraception. When you start to put these reports together, actually you see perhaps a conflicting information, lots of different information. Our contraceptive use data, when we ask women, are you currently using a method, actually shows very little change in emergency contraceptive use over time. If a woman says, are you currently using? So we would say, this is curious. Why is there procurement here showing a increasing procurement trend? We've known for years, however, from other data sources, from DKT social marketing report, from procurement data like this, that there seems to be a growth in emergency contraceptive procurement. Well, it's led us to different kinds of questions. And so now the most recent round of demographic health surveys asks us an additional question. It asks, have you used emergency contraception in the last 12 months? Very different answer. And we are starting to see in some countries a real reporting, an increase in reporting of use of emergency contraception, particularly Ghana, up to 10% of women of reproductive age are reporting emergency contraceptive use in the last 12 months. Now, we don't have that question for many countries now, but in every DHS that comes out, we're starting to see it. So it's an increasing share, largely, however, we think from private sector sources until more recently. So now it could be that the public sector is catching up with this trend in the market. And more public sector facilities are starting to offer emergency contraception, whereas that was something you would go to a pharmacy to get previously, depending on the country. So we really need each other, all of these reports, to try to get insights into what is happening with contraceptive use, with markets, with method transitions. And this is, I think, a story of method transition. Now, why people are using that is a different story. And now we need a new data partner to help us with consumer insights. And I think we have people on this call who are actually trying to look at consumer insights using different types of data. So I think that's the why is something that we still need to explore further. Thanks, Vidya.
Thank you, Jason. Moving on to the next question in the Q&A, there is a question on opportunities to track local procurement from the region to drive long-term sustainability. I see, Martin.
Sure.
Please share your response.
So it's not good practice probably to question the questioner, but my point would be, which region are we talking about? I'm making a supposition that we're talking about sub-Saharan Africa, but I might be wrong. But please, whoever asked that question, anonymous participant, be in touch with me. Let's talk a lot further. We don't have time to explore it on the scope of this call. But what I would say is there's huge interest among RHSC's membership, an array of countries in sub-Saharan Africa, the supposition I'm making in this subject, and a great deal of local procurement occurring, and indeed local manufacturing as well, as our recent report on maternal health supplies manufacture in sub-Saharan Africa showed. And we are starting to capture within RHSC's Visibility Analytics Network and RHVIS these local government, these direct procurements that are happening. There is, and this very much speaks to Mansi's point earlier on, we're in a sort of a phase of progressive realization. And in the next 10 years, we are aiming to have that even fuller visibility. Our suite of data products, the Visibility and Analytics Network of RHSC within that aims for that much greater visibility for decision making. So there's no reason why we shouldn't have that aspiration. But I'd love that person to get in touch with me to talk more. It's a central part of RHSC's 10-year strategy and our 4-year program of action. So more to come, and back to you, Vidhi. Thanks.
Thank you, Martin, for taking that question. We have just one final question left in the chat, which is, what is the ratio of procurement and use? Jason, I see you have volunteered to answer that question, so I'll turn to you.
Yeah, I mean, I'm not sure I totally understand the question. It could be interpreted in two ways. Are we able to track that procured contraceptives actually are used? We are not able to do that. We don't track from shipped data to the actual use of that product. What we do try to do each year, and this is a reason for this collaboration, why do I participate each year, is to try to look at our use data, which is coming from surveys, from health management information systems, And we try to match those trends to what we're seeing in the procurement trends. Do they resemble one another? Does this increase in implant procurement actually seem to match what we're seeing in use? And absolutely it does. I mentioned that shift, but I'll say it in numbers. In 2012, there was only one country where implants was the most common method used by women, and now, 12 years later, there are 26 countries in which implants are either the most used or the second most used method. Now, this has happened over time, and we've seen that procurement trend in implants increase over time. And we've seen declines in other methods as a result. And I think that's how we try to look at the rate procurement versus use, but we don't try to quantify a ratio. I hope that helps to answer the question. Thanks.
Thank you, Jason, for that response. That brings us to the end of all the questions that we had in the chat. If anyone has any further questions, please feel free to reach out to us over email. We're always happy to respond to these questions. I will finish this segment and again pass it over to Martin to close us out for today's webinar.
Thanks, Vidhi. Really appreciate the great work of our combined teams across the 3 organizations and all of our members for this work. Appreciate 70 minutes of the valuable time of all of our webinar participants. Please do go to the website, go to the dashboard. There are reams of fascinating data at absolutely your fingertips. We don't take lightly this partnership, this work together, the collective work that we do in the face of many challenges. Those 10 years show how resilient we've been as a community through the COVID pandemic, for example, how resilient we need to continue to be, even in the face of day-to-day challenges. And Tinder and other colleagues in Zambia at the moment dealing with power cuts 95% of the time, hence the audio not too good. But Tinder, thanks for that. And thanks to everyone for the resilience you continue to show in highlighting the progress we are making as a global community. Thank you so much. And we look forward to seeing you again next year. Take care, everybody. Good evening, good afternoon, good morning. See you soon.
Thanks, everyone.
Everyone.
Bye.